Dear Commissioner, dear Minister, Vice Minister, dear friends, ladies and gentlemen, it's a great honor for me to be here in Riga and at the opening session of the health conference. I'm happy that this topic, healthcare, is on the radar screen on the European institutions. This is what was also decided in Vilnius 2 years ago, not far from here. We policymakers at the European level, but also national level, we need to get from the stakeholders the information to know the situation on our, for our patients in each of the member states. We are lucky that one of the actors in Vilnius is now acting as, and promoter of the Vilnius Declaration is now acting as a commissioner for health. And in this role, he is committed to work closely with the member state to help them improve the efficiency and sustainability of our health systems. The topic of our discussion is how have we responded to the call of actions in the Vilnius Declaration. But before this, I think we need to answer the other question, why do we need a European response in this first place? We know, and we are always confronted with this, every time when we speak about healthcare at the European level, there are coming people and saying, no, this is a primary responsibility of the member states, you have nothing to say here in the European Parliament. But we know that in the same time we see some national healthcare systems are underperforming in terms of policy spending efficiency, also access to quality medicine services. This results in health inequality that provoke migration of patients toward member states where medical treatment is better and easier to access, in some cases life-saving. The same holds true for medical healthcare professionals, doctors and nurses who are leaving their countries for better jobs. As a result, health needs are not equally addressed across the European Union, with tangible consequences for the performance of the European workforce. Poor healthcare quality in one member state provoke burden for the budget and social security systems of the rest of the European Union, and the European Union growth and jobs objectives are undermined. At the end of the day, it is the patient that are paying the cost of non-Europe in health. And if we at the European level are talking more on better care for animal welfare than for human health, why should European Union citizens trust in the European project? It is because health inequalities undermine our strategic objectives that they present a common European challenge for the Union as a whole. The difficulties of individual countries to tackle the issue make a strong case for more coordinated approach. Now our response to the Vilnius call of action to work in partnership toward equitable health together with the European Patient Forum and here I must say also the Bulgarian National Patient Organization who took the lead and created a platform, Patient Access Partnership, for European health stakeholders to join forces, develop and propose sustainable solutions to ensure equitable patient access to quality healthcare. We and many of my colleagues in the European Parliament followed suit, and in January this year, I, in the presence of Commissioner for Health, Andriukaitis, announced the establishment of the MEP interest group of access to healthcare. The group has committed to raising awareness, according to the call of actions, about patient access problems and to ensure the future of the European Union policy agenda. This issue deserves more attention because we see that such problems are present in each of our member states, but they are manifested in different ways. So only a holistic approach that access the various barriers can allow us to make the right diagnosis and subsequently prescribe the right treatment and services. This cannot happen through a one-size-fits-all approach, and it needs to take into account a different arrangement for healthcare in the member states of the Union. Currently, we lack the tool to measure access in reliable and objective manner, and this presents a huge gap. I'm very happy what I hear from Commissioner that there's created a work group in the Commission who is working exactly on assessment of the access to quality healthcare in the member states. Decision makers, both at national and European level, depend on the availability of timely and comparable information to develop and improve efficient policy solutions. The existing indicators have limitations and do not allow us to get the whole picture and properly assess the accessibility of our health system. This does not mean that rank or grade individual member states or say this is bad or this is good, but this will enable us as policymakers to take the right decision. Health is a value in itself, but also has a major role to play in achieving our wider goals. This principle has to be recognized and consistently reinforced through all European Union actors and policies. What the Minister and Commissioner mentioned, this is very true. Each euro invested in prevention saves many euros for healthcare. And prevention is sport, is better food, better lifestyle. This is one of the priorities which European Union can provide to our European citizens and help the member states through also European semester and the health recommendation to the member states to achieve more and better access to quality healthcare according to the 21st century standard. Thank you very much.